4,000 young women in Sub-Saharan Africa are infected with HIV every single week. And at the same time, testing has dropped by 41% on the continent due to lockdown restrictions. Now, these are just some of the challenges being discussed at a conference held in Durban. The 21st International Conference on AIDS and STIs in Africa brings African experts together to find solutions. So for more on this, we're joined now by the Treatment Action Campaign's Sibongile Tshabalala. Ms. Tshabalala, thank you for your time and good morning to you. It's quite an important conversation to have because oftentimes when we speak to, HIV and AIDS activists or even health experts, they have lamented that for the past couple of months or even these past 2 years with the pandemic, it seems conversations, awareness, testing around HIV and AIDS has dropped because obviously the focus has been more on COVID-19. What's your perspective when it comes to, awareness as well as testing on HIV?
Thank you very much, and thank you for having me. Yes, the services of HIV it has dropped drastically during the past 2 years since we have been facing COVID-19, and that worries us because while we are dropping the ball on fight of HIV, we are seeing numbers of people who are infected. Other infections that are AIDS-related are also coming back and are also a challenge. We have seen people living with HIV being turned away in facilities to say, no, we cannot help you because we are focusing on COVID. So what we did as a country, we put HIV on pause as if it's no longer there. The only thing that is there, it's COVID-19. We only realize later when we start to see things happening now, seeing losing people on treatment, losing people because of death, of AIDS-related death. That's when we start to say, no, we've made a mistake. We're not supposed to do this. Let's bring people back to facilities, which is no longer an easy thing because we said, our government said, people, they should avoid going to facilities at the during COVID because that's where the virus is mostly at. So that is worrying for us as people living with HIV. And today we are talking about young people who are infected with HIV, which we are worried to say, where are those people and how do we support those people on the ground?
Yeah, and speaking about those numbers, I mean, quite concerning. Earlier on, I mentioned 41% being the percentage point in terms of how much testing has dropped. 8 million people in South Africa alone living with HIV. But I know that what's equally concerning, as you mentioned, about young people is young women. It seems more and more young women in South Africa account for new infections.
Yes, we still have that challenge of young people accounting for who are infected with HIV. But what we are worried about as activists is that as much as there is funding that talks to prevention, especially for young people, we are talking about PrEP, we are talking about condom use, we are talking about sexual behaviors and all those things. But the question is, where are the youth-friendly clinics? Where are the youth-friendly facilities where we can take these young people to? Because the clinics that we are using, the facilities that we are using now in South Africa are not accommodating us as old people who are living with HIV. How about a young person who is supposed to wake up at 3 a.m. to queue for medication? They don't have that time. They don't have patients like us. So we need to have innovative ways of treating young people and also bringing them into an agenda and have a conversation and understand to say what could be the problem, why they cannot use a PrEP as prevention, why treatment as prevention it's no longer working for them, what could be the problem, what is happening actually.
Ms. Tshabalala, can I ask you this? Could discrimination, stigma, and the peddling of fake news around HIV be a contributor, especially to young people? We spoke about clinics, access to clinics, and could it be that young people don't want to be seen in these public clinics having conversations around HIV, testing, taking PrEP, because they don't want to face stigma? I'm asking this because just yesterday, my colleague and I, Gareth, were running, a daily poll question around testing for COVID at the workplace. And one of the tweets that came up was a very ignorant tweet, and I'm just sub-quoting it here. The person who sent the tweet said that they do not want to test, or rather, they don't want to take the vaccine because they don't want AIDS. I mean, that for me told me there's still a lot of stigma and a lot of fake news peddling. How do we then expect young people to confidently go to public clinics, have conversations, take PrEP, take the treatment without the fear that there might be someone working there looking at them that might reiterate the same sentiments?
When we are doing all the report, we are launching report, provincial reports on Richitse. What we are facing, what we are seeing when we look at the Richitse report is the issue of stigma in facilities. The stigma now, it's no longer in communities, it's within facilities, where people living with HIV are made to queue outside and queue on the different line from others. People who are living with HIV who are made to take their treatment on the another side of the clinic. And those are the things that already people who have been living with HIV for a very long time, who are no longer young, make them uncomfortable to go to facilities. So how do you expect a young person to go there while she can see, or he can see, the treatment that people living with HIV are getting in facilities? So our system already stigmatized us. So it doesn't accommodate us as people living with HIV. Secondly, we are no longer having that discussion on the ground with young people to say, this is what is happening. The information, the treatment literacy, it's no longer there. Because most of young people, when we talk to them, they're scared. They are not. They don't want to take a PrEP because they are scared to say their partners will say they are HIV positive while they are not. So what is mostly important is education, it's information sharing, and also make means that young people they have the space for youth-friendly services, which it will be led by young people who understand these issues, especially young people living with HIV. It can be easy. But then we are not getting a positive response in that aspect when we are engaged with government. They only agree on with how to say we really need them, but at the end of the day, there is nothing that the government is coming to party to assist us to have youth-friendly facilities. So that
we're hoping that the 21st International Conference on AIDS and STIs in Africa, which has already commenced, I understand, in Durban, can bring those solutions.